Welcome back, everybody. February, of course, we think a lot about the heart because of Valentine's Day, but it's also Heart Month for another reason as well.
Of course it is. Joining us is Dr. Frank Navetta with ETMC Cardiovascular Institute, and today we're talking a little bit about sleep apnea and how it relates to cardiovascular health. Welcome, Doctor.
Thanks to have you.
What exactly is the relation? Because you don't normally associate the two together, sleep apnea and cardiovascular health.
Yeah, I think the relationship is complex. You know, we've gotten really good over the past couple of decades at treating people with heart disease. We're fortunate in cardiology that we have a tremendous scientific evidence base to which to base our treatment on. But sometimes, despite that, and despite the patient's best efforts to take care of themselves, there's something missing. They keep relapsing, they're in and out of the hospital, they're trying to be compliant. And I've found in my own practice that sometimes what it gets down to is an unrecognized problem, sort of a residual risk, which oftentimes is sleep apnea.
Does everyone who deals with sleep apnea also have heart problems? Do the two go hand in hand?
No, they don't, but they're very common.
Yeah.
Sleep apnea, it's estimated that probably 25 million adults of working age have sleep apnea. The problem with that is 75% of them may be undiagnosed. Living in East Texas, you know we're at ground zero here for cardiovascular disease, so they're both common. They're both pretty easily recognizable by the old standard of a good history and physical. They're dangerous independently, they're synergistically dangerous together, and they're eminently treatable if the diagnosis is made.
What are some of the cardiovascular diseases that can relate to sleep apnea?
I think really there are three. Probably the most basic one is hypertension, which we know millions of people have hypertension. There are schools of thought that even say that sleep apnea is a cause of hypertension. Most of the hypertension we treat in the United States is essential hypertension, which essentially means we don't know what causes it. But new onset, we need to consider sleep apnea as a cause. Congestive heart failure can be worsened in terms of symptoms and even in terms of survival by sleep apnea. And certainly arrhythmia. It's a very common arrhythmia that we deal with all the time is atrial fibrillation. And there is data to suggest that people who have inadequate treatment of sleep apnea have a higher recurrence rate of atrial fibrillation.
Can all of these be controlled with proper diet and exercise, which you guys always preach that, but also medication? This is something that's not a death sentence if you have it.
No, it's not a death sentence, but if you look at risk factors for sleep apnea, they very much parallel the same risk factors for coronary disease. And the one we're continually beat up about in the United States is the growing obesity problem, which is a real problem. That's going to clearly play into cardiac disease. It's going to have tremendous impact on sleep apnea as well, because most of these people are overweight.
And can you treat both hand in hand at the same time, or do you have to treat the condition separately?
No, in fact, you need to treat both hand in hand at the same time. You need to apply what the evidence-based treatment is for whatever the cardiac disease is, and then if it's suspected by a good history, by talking to the person's spouse, by asking them if they fall asleep frequently during the day, you need to treat them both in conjunction, because there is data to suggest that if you treat sleep apnea effectively, you can improve people's pump function in heart failure, you can improve their recurrence rates in atrial fibrillation, and you can improve their hypertension. People, for example, who are on more than 3 blood pressure medicines and have not met the goal blood pressure of 140 over 80, we term that resistant hypertension. Over 80% of those people may have sleep apnea.
Oh, wow.
So it's a huge problem that I think is largely unrecognized.
And you know, it won't be recognized, and you can't get help if you don't see your doctor. And you certainly need to do that. Dr. Frank Navetta with East Texas Medical Center Cardiovascular Institute, thank you for these answers. Thank you for visiting with us. We appreciate it.
Thanks for having me.
Thank you.